Hello, I'm Dr. Lola Ashaye, a board-certified family medicine and lifestyle medicine doctor, and you're listening to Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. So since starting my practice, and I've had to do a lot of non-doctor things, so I've had to do networking, had to learn about business, and any of you that have started a business or practice, you know what I'm talking about. Well, with all my networking, I've talked to a lot of business owners, and one major pain point is healthcare. Many of them have a hard time finding affordable healthcare for themselves and for their teams. And several business owners don't have health insurance, and they don't offer a health plan to their teams, which makes it difficult for them to find a team, to find team members, and often also affects retention. Well, next week, I have a special guest coming on the platform, and she'll be sharing more about health plan options specifically for small and mid-sized business owners. So be sure to tune in and learn more about that. Today, though, in the spirit of National Primary Care Week, I like to give a framework to those who may have delayed their care on what they need to be doing to become or remain healthy, and some of the things they should be looking out for. So that's what we're going to talk about today. But before I get into it, you know it, if you haven't subscribed, please go ahead and subscribe. It really does help people know about us. It helps them learn this information, especially if you're finding this useful. That's how it works. Like the more you subscribe, the more you like the videos, then other people learn about us and they learn this information because it's shown to them. So as I mentioned, you're listening to Connecting the Dots. I'm Lola Ashaye. I'm a primary care doctor, owner of InTouch Primary Care in Sugar Land. And what we do here is we help you easily become and remain healthy with direct and easy access to the doctor with proactive health care. So if you are tired of a reactive approach to your health care and you want to build a healthier lifestyle, then our services are perfect for you. Okay, so let's get into it. What are 3 key actions to stay healthy and maintain good health? So the very first one I want to talk about is build a solid health foundation. Our bodies are amazing. We have a built-in ability to heal ourselves. And it's basically a machine, but it works in a very specific way. And so like with other machines, if you treat it well, it works well. If you don't, it doesn't work well. So that's kind of how it goes. And our bodies have certain basic rules. And when we abide by them, we feel great. When we don't, then it's not the same, right? But a lot of us know these rules, our bodies teach us, but many of us struggle to do them. But if you're listening today, it's worth it to revisit these 6 areas of health and start improving at least one of them. Make an effort, make a decision, start to work on one at a time and start trying to make some improvements in one area. So the 6 areas necessary to stay healthy and maintain good health: healthy nutrition, we've heard about that, consistent physical activity, restful sleep, stress management, healthy relationships, so social connections, and avoiding harmful substances. So these 6 areas are really important for health, and I've talked at length about each of these areas, so you can check out our previous videos to learn more about whatever specific area you want to work on. But without a healthy foundation, what happens is when you start adding medicines or trying to supplement your way to a healthy body, it doesn't work. Those things don't work because there needs to be a basic foundation that you can stand on, that your health can lean on, and then you can build on it with other things. But when the foundation is not good, it really does affect how everything else works. So I hear people say, oh, this person didn't exercise and they lived until 100 and they were fine, or, this person smoked until they were 90. It's not one size fits all. Everybody's going to be different. You can't compare yourselves to others though, because our genetics are different. It affects our health, our environments are different, our family histories are different. So you don't know what you can get away with or what somebody else can get away with that you may not be able to get away with. So taking the chance and comparing yourself to even your sister or even your spouse can be problematic because they have a whole different genetics. They may go to work in a different place than you work. All those things make a difference in what happens with their health. So at the end of the day, it is worth building a solid health foundation, because when we do that, we actually feel better and we're much less likely to become ill or need medications. And we just are more productive. We have more energy. We enjoy our lives a lot better. So again, recommend that you start looking into at least one area and work on that. That's a very good way to maintain good health or to become healthy. Okay, so the second thing I want to share today is do checkups routinely. So I am sure many of you know some people who do all the right things health-wise, but they still end up with an illness, or sometimes something very serious, something terminal. And unfortunately, despite our best efforts, and especially despite feeling great, our bodies can still malfunction. And that is why, in addition to doing the best we can, feeling great is not enough. It's not the greatest indicator to know whether or not you're healthy. You know whether you're healthy when you check. So it's really important that we do our checkups. And there are 3 major things you should check for routinely. How often will really vary depending on the person, but I'll give some kind of generalized idea. But again, it's very, very variable because healthcare is personal. It's not one size fits all. So for instance, one of the major things you would want to check routinely are your vitals. So that includes your blood pressure, your heart rate, your weight, obviously your temperature and all that stuff as well. But the blood pressure, heart rate, your weight are important to check from time to time. Weight can be, it depends on the person, and there are people that have conditions that it may be better for them not to check their weight routinely. But generally speaking, many of us should be checking these things at least yearly. Some people it might be a lot more often depending on the conditions that they have. Okay, so vitals, very important that you're checking that routinely. We check vitals because many people with high blood pressure don't know they have it. Many people don't have any symptoms whatsoever of their blood pressure being high. So it's important that you check it so that you know if it's abnormal, if it's too high, if it's too low. The other thing is annual labs. So labs can screen, or physical labs, I should say, not necessarily annual. Labs can typically screen for diabetes, high cholesterol, anemia, liver, kidney disease. Sometimes we screen for thyroid disease. Sometimes we screen for sexually transmitted infections. There are many different things that we can screen for depending on your risk factors, but most people would need screening for like diabetes, high cholesterol, liver, kidney disease, anemia, right? And sometimes it can be every few years, depending on what your last test results are, what your family history is, and all of that. But sometimes it's every few months. So it just depends on the person. But this is something that if you haven't had done in a long time, it's really important to get done because, again, a lot of these conditions can happen and you may feel perfectly fine. And you could have really high cholesterol or diabetes. So it's important to check. The third major thing that should be checked for when you're doing your checkups is cancer screening. So major cancers that we typically screen for are pap smear, cervical cancer with a pap smear, which starts at age 21. So pretty early on, we start screening for cancer. And then there's prostate cancer screening, which can be done with a blood test, and you can start at between 40 and 50, depending on risk factors. Colon cancer screening typically starts at 45. Breast cancer screening starts at 40. So a lot of these cancer screenings start pretty early on. Like I said, the cervical cancer screening starts at 21. And sometimes we may have to screen sooner. We may have to screen more frequently, depending on your personal health history, your family history, your environment. There are many things that would affect when we start screening. Also, there are many other cancers that may need to be evaluated for, again, due to your genetics, personal history, and that sort of thing. So it does make a difference to screen for cancer, because many cancers, when they are detected early on, they have a much higher chance of cure versus those that are detected later on. So it's really important to, take the time, make sure that things are screened for. In addition, there are many other conditions that can be prevented if they're detected early, things like osteoporosis, right? So doing a bone density scan can be helpful. Other things that we discussed during your checkups are vaccines. Have you been vaccinated for conditions like pneumonia, tetanus, shingles? These can be addressed, and vaccinations can really reduce the severity of illness if you were to contact some of these things. The other thing is, people that perimenopause, menopause, navigating those symptoms, those are the types of things you can discuss with your doctor during your checkup. So your checkups are a perfect time for you to talk to your doctor about things that have not happened yet, but could happen, and making sure that you are up to date for you based on your risk factors, based on your age, based on your symptoms, making sure that everything that needs to be happening is happening so that we're not having complications down the road. Okay, so we've talked about number one, build a healthy lifestyle. Do your best. I know it's not always easy, but do your best to do that. Number two, do the checkups, because just relying on how you feel is not an indicator for good health. And then the third thing I like to share is don't ignore symptoms, but don't Google it either. But don't ignore them, okay? And this one is really important because at times our bodies will warn us about a symptom, and sometimes because it's inconvenient to see a doctor, or maybe sometimes we're in denial, or we just don't want to know, we just let it drag on. And then other times we'll Google it and we just scare ourselves, or we misdiagnose ourselves. And either way, we're suffering needlessly. So if you have a symptom, address it, and if you've tried to address it and you feel like you were not heard, find somebody else that will listen to you, but don't ignore your symptoms. Your gut feeling is important. Make sure you're satisfied with the answer that you're getting and that you're at peace with it before moving on, because your health is too important. You don't want to take it for granted. Okay, so by doing these three things, working on building a solid health foundation, doing your routine checkups, addressing symptoms in a timely manner, you can stay healthy and maintain good health. So if you've been delaying your care, and I'm talking to my business owners, consider doing something today. And if you don't have a doctor, we would love to see you if you're in the Houston area. We're InTouch Primary Care in Sugar Land. You can check us out on our website. Health insurance is not required to come to our practice, so that would not be a barrier for you. So check us out, intouchprimarycare.com, or call us 713-280-9985. So many successful people, many business owners will tell you that prioritizing their health is a major key to success. So imagine you start doing that. You're going to become more productive. It's worth it, because after working so hard, after building your dream, you don't want to spend your time in pain and discomfort because you neglected your health. You want to actually enjoy the fruits of your labor. So don't delay your health. Don't delay your health care. I hope that helps. That's what we have for today. And I will see you next week. We're going to be talking again, as I mentioned earlier, healthcare options. So if you're a business owner, small business owner, mid-sized business owner, you're looking for health options, healthcare options, please be sure to tune in next week. We're going to have some of those options for you so that you can make decisions about your health that hopefully will keep you healthy in the long run. All right, I'll see you next week.